Hey everyone, my name's Haley Arnold and today we're going to be performing range of motion on the wrist via the Kentucky Medicaid Nurse Aid book, aka the Bible. Now first things first is before I ever enter a room, I want to make sure that I knock on the door and I get the patient's okay to enter. So I would approach the patient and I would double check and make sure that this is the patient I'm supposed to be performing these exercises on today. Check the patient's wristband. Hello Mrs. Smith, my name is Haley Arnold and today I will be performing range of motion on your wrist. At this point, I would perform my hand hygiene. Once I've completed that, I will pull the curtains back of the patient's room to make sure that we have enough privacy. The next thing that I want to do is I want to make sure the bed is at a comfortable position for me, for my body mechanics, and I want to make sure that I'm not tippy-toeing in any way, nor am I leaning over the bed too far. Now, anytime that you're going to be moving the bed up or down, you want to take extra precautions and make sure that the side rails of the bed are pulled up. Now, we're going to use our imagination a little bit, and since I'm not in a traditional classroom setting, I'm going to be using a broomstick to simulate the side rails. So I'm going to put the side rail up on the left side, walk over to the right side of the bed, side rail up, and then I'll position the bed in a comfortable position that's for me. Next, since I'm going to be working on the left side of the body first, what I'm going to do is lower the side rails on this side of the body. Because anytime that you're going to be working on a patient or a resident, you do not want to be working over the handrails. Now what I'm going to do is I'm going to take the patient's hand, and the first one that we're going to be doing is extension. Extension, think of it like an extension cord, just straight out of the body. The next one that we're going to be doing, this is called flexion. Flexion is just going to be straight down. We're going to go back to extension. And then we're going to go to hyperextension. And if you were to do this exercise at home yourself and you were to bend your wrist backwards like this, you can feel the stretch within your wrist all the way to about the middle of your forearm. Then we'll go back to extension. This bone on the outside, this is called the ulnar bone. The ulnar bone's closest to the pinky. We're going to be moving to the ulnar side. And then this is the radial bone on this side, which is also where you take your radial pulse, closest to the thumb. We're going to be moving to the radial side. And you want to make sure that during these exercises, the patient is in a comfortable supine position. And also the extension is nice and straight. So once we have done this exercise about 5 or 6 times on this side of the body, what I'm going to do is I'm going to put the side rail up. I would walk over to the other side of the bed, put the side rail down on the right side, and I would perform the same exercises. So we have extension, flexion, hyperextension, and also remember that you don't want to manipulate the fingers or the palms in any way. Remember, we're working and focusing on the wrist today. And remember, during the exam, you do not want to say hypertension. Hypertension corresponds to blood pressure, and that's not what we're focusing on today. So after I've done the flexion and hyperflexion, I'm going to do my ulnar, and then my radial, and again, about 5 or 6 times of those exercises on each side. Once I'm done with the right side, I'll put the side rail back up, and before I move the bed back down, I just want to make sure the patient's comfortable. And again, we're using our imagination since we are not in a traditional classroom and or hospital setting. This is going to be our call light. I'm going to put the call light within perfect reach of the patient to make sure that if they need anything, we are just a button away. Now, before I move the bed back down to its original position, I'm just going to make sure that the side rails are up. So the side rails are up at this moment. And I would put the bed back down to its original position. Side rails down. Other side. Side rails down. And then at this point, I would perform my hand hygiene, and then I will report and record. And you have just completed the range of motion from the Kentucky Medicaid Nurse Aid handbook. Thank you.